The gains made under the Affordable Care Act could be reversed under the Republican-backed replacement plan, according to the Congressional Budget Office, which estimates that millions will lose insurance. Those numbers were released yesterday afternoon. I want to bring in Florida Democratic Congresswoman Debbie Wasserman Schultz. Congresswoman, always good to see you. Thanks for being with me.
You too, Craig.
The CBO reporting found that some 14 million additional people could become uninsured next year. Your reaction?
You know, CBO has confirmed what both Democrats and Republicans knew were coming. The Republican repeal and don't replace plan, also known as what will be known as Trumpcare, will be devastating. Devastating because it will take health care away from millions of Americans who gained it under the Affordable Care Act, because seniors will see their health care costs skyrocket, because people who have pre-existing conditions like I do as a breast cancer survivor could face upward of 30% additional premiums if we have a gap in coverage, because countless people, from the poor to the elderly, will now be in a situation where they will not be able to afford their coverage, all while providing massive tax breaks in the largest transfer of wealth from middle class to wealthy people in history. The Trump administration, as you know, disputing the results of the report. This is part of what Health and Human Services Secretary Tom Price said this morning on Today. Take a listen.
We disagree strenuously with the report that was put out. We believe that our plan will cover more individuals at a lower cost and give them the choices that they want, for the coverage that they want for themselves and for their family, not that the government forces them to buy.
Obviously, that was this morning. That was outside the White House after a meeting there. Disagree strenuously. The words from the secretary. What's your take? I mean, could the CBO numbers be wrong? Could they be misleading at all?
Well, the irony in Secretary Price disagreeing with the CBO numbers strenuously is that he actually appointed the director of the CBO. And so this is someone who he had immeasurable respect for, who I presume they hired because they wanted to make sure that they had the strongest possible projections coming out of CBO. And to add more irony, the White House actually projected even higher numbers of uninsured would result from their repeal and don't replace plan. So nothing they say is believable, since day one. I was actually elected with Tom Price to Congress in 2004, know him well. He's long been an opponent of universal access to health care. The Republicans don't support it. But the major irony here, Craig, is that the insurance mandate, and Doug Holtz, I listened to Doug Holtz-Egan right before I came on here. The insurance mandate and the idea of it actually was conceived by the Heritage Foundation, one of conservatives' leading think tanks. So this is something that they actually conceived, Republicans and conservatives actually conceived, because they knew that the only way to make sure that we could really provide access to coverage for everyone is to put healthy people in the risk pool and spread that risk. When Paul Ryan did his dog and pony show trotting out their plan last week, he essentially defined insurance when he said that what Obamacare does is it has healthy people paying for sick people so that they can get access to health care. Yep, that's what insurance coverage is. And we need to make sure that we continue to provide access to affordable health care for everyone, because if we don't, then taxpayers will go back to paying for it through emergency room visits, where we have cost shifting that went on, and you had tens of millions of people who didn't have health care coverage. That's not the direction we need to go, or that Americans want to go.
Florida Congresswoman Debbie Wasserman Schultz. Congresswoman, thank you.